If pelvic pain is holding you back, a pelvic floor specialist could be the answer. Here's what they do and when to see them. After you understand you have pelvic floor dysfunction and you're referred out for treatment, there are two groups of pelvic floor therapists. Majority are physical therapists, but there are also specialists like chiropractors, occupational therapists, nurses, nurse practitioners, and physicians who get the training to treat pelvic floor. The training itself talks about breathing and movement, but a good 95%, if not more, of the actual training is doing the internal work through the vagina and or anus, using the index finger to see the tension or weakness of those muscles inside. So let me grab. This is the pelvis. I'm talking about these muscles here. The body cavity has all these muscles inside. So when they're in with the index finger, inside the body cavity, they're asking you to follow their instruction with breathing, manipulating the muscles on the inside. Sometimes it happens that it's helpful actually, and sometimes they give you some basic exercises to do at home. Most therapists see females, but there are plenty of men who have pelvic floor issues but have a hard time finding a therapist that sees male patients. Most pelvic floor therapists do the internal work, but there is a very, very small percentage of pelvic floor therapists, such as myself, who don't do any internal work. And here's my reason. I know there is a reason why the muscles inside of the pelvis are off, and I want to know why. So I go to evaluate to see how the muscle tone of the inside of the pelvis has changed. Why has it changed? It's almost always addressing pelvic stability that will fix the problem or alleviate the problem. Frankly, my thought is that the index finger can only reach so far, and the tension or weakness is not just how far the index finger can reach. From my experience, by the time we're done stabilizing the pelvis, we have provided the essentially fertile ground for the body parts to perform their job and for the issue to go away and stay away. The most challenge I see is that patients don't have the patience. Good one. If a bone breaks, it takes 6 to 8 weeks to heal. Sometimes it takes longer, sometimes it's 6 weeks, depending on some factors. There are other comorbidities, other things that can happen, but that's about what it is. It is what it is. If your level of dysfunction is a lot, if you have a bunch of feeders to your problem, you have two choices: to start chipping away the problem or to never start. Take the time to understand what your body likes when it comes to your pelvic stability, provide the likes, understand the principles of movement, and you're set for life. I have a ton of free stuff on YouTube and social media, and not holding anything back information-wise. Take advantage of them, and if you need help, you know where you find me. Make sure you subscribe, and until next time, take care.